Hey Swifties, so sometimes we get some members coming in and saying that they've got a little bit of groin pain through here, or their hip just feels a bit discomfort, or it's a little bit out of whack. So this little sequence that we do quite often sorts that out. The first thing what you want to do is get your grid roller and roll through into those hip flexors. So just into that point where you would hip hinge, or 2 fingers down from your hip bone. Remember, look after your lower back. So by having your leg out to the side, activate through your core 4 times up and down. Remember, you don't want to be covering a huge area. You only want a small area that you're kind of rolling and creating that friction. 4 times side to side, and then 4 times up and back. And then you can repeat that if you like. So 4 times up and side to side, up and back, and then heel to bum from there. After you've done that one, then what you can do is come in, so using a knee pad, a lot of people like to use a knee pad, and then you've got the resistant bands from here, which they're quite thick, these ones, to give you a bit of tension, and you want it slightly back on an angle so that when you're looking forward you can't see the band, but it's definitely not directly behind you. And from here we want height. There's a fair bit of tension going through with that hip, and drive the arm up, so a little bit forward, but lots of height. And you can do that about 5 or 6 times. Stand up, walk around, and see how you go. In addition to that, that might give you guys a little bit more of a result, is coming down and rolling through into those adductors. So just above the knee, rolling through into there. A lot of people find themselves quite tight, making sure your back's in a nice position, and then up and down from here, and then kick it out. So just use the number 4, so 4 of each. And you can also come a bit higher into that groin, going side to side from here, up and down, so 4 times side to side, 4 times up and down, 4 times kick out. And then from here, the movement that you can do is coming out from here. So we did this leg, and then we want to drive out. So drive. So this knee straight, we're getting into this area. Now if that's uncomfortable in relation to your mobilisation, you could come up. You want to have the leg that you did out straight, and some people find that that's a bit more effective for them as well. But they're your 2 choices to mobilise afterwards. See how you go with that, see whether that gives a bit more comfort to your hip, and make sure you come and see if it persists. Thanks guys.